Welcome to 6ABC's Local Spotlight. The following advertisement is paid for by Mainline Health. Here's Jessica Boyington.
For women of all ages and races, the number shows that heart disease is the leading cause of death. However, research has continued to show that heart disease is especially common among communities of color. Among Hispanic communities in particular, women develop heart disease a full decade younger than non-Hispanic women. And we're here today with Dr. Maribel Hernandez, cardiologist at Lankenau Heart Institute, part of Mainline Health and medical director of the Women's Heart Initiative. Dr. Hernandez, welcome. Thanks so much for being here with us today.
Thank you for inviting me.
All right, so let's get right to it. Why should we be thinking about heart disease risks?
1 of 3 men and women die from heart disease. So it is, as you mentioned, the leading cause of death. And women account for 50% of the cardiovascular deaths. It turns out that 70 to 80% of cardiovascular disease can actually be prevented. That's why it is very important that we are aware of our heart health risks.
I think it's something that probably everyone just heard and was a little shocked about, that heart disease is the #1 killer of Hispanic women. I've never heard that before. Why is that?
It turns out that Hispanic women have a worse risk profile, with higher numbers of women having diabetes, uncontrolled hypertension, and metabolic syndrome. Women may not have access to health insurance, healthcare providers, even fresh, heart healthy foods.
What can we do to protect ourselves from heart disease?
Find something that you enjoy, an exercise that you enjoy, so that you can stick to it and exercise regularly. With heart healthy diet, you can prevent development of diabetes, hypertension, which are very important risk factors for heart disease, and not to mention to keep a low cholesterol. Learn your own personal risk factors. Learn your family history to see there's any genetic component to the history, and learn your numbers. You need to know your blood pressure. What is your glucose level? What is your cholesterol?
What other advice do you have for any women watching this today that might be nervous about this affecting them in the future?
Be your own advocate. If you have any health concerns and you go to a healthcare provider and they're dismissed or ignored, get a second opinion. Try to figure out what's going on. Many physicians and healthcare providers still think that heart disease is more prevalent in men. And many times they dismiss the symptoms when women present to them. Let's say you're Spanish speaking or any other language, you have the right to ask for an interpreter. All Mainline Health System and all the health systems in the United States emergency rooms, they have medical interpreters via phone lines and video, which are knowledgeable in the medical terminology and can interpret. So language should not be a significant barrier when you go and see a healthcare provider.
Dr. Hernandez, thank you so much for sharing all of this information with us. This was eye-opening.
Thank you.
So to learn more, you can visit mainlinehealth.org/wellaheadphilly.
Thanks for watching 6ABC's Local Spotlight. The preceding advertisement was paid for by Mainline Health.